there's someone who is looking to do something a little bit more invasive, like maybe a tummy tuck or a rhinoplasty, what would you suggest to them for them to do their homework before they come in, to even to come and see you? What would you want a patient or a client to do before even coming to see you? Like, and can you explain, say something, if we take an example of a tummy tuck, what is the process of that? Because I understand, it's not just having the treatment, it's before, during, and even after, because
oh my God,
there's a lot of psychologically as well, you have to be prepared. So if we take an example of a tummy tuck, what would you suggest someone should do before seeing you?
So someone who is coming for a tummy tuck, first of all, they have, there has to be a certain criteria. For example, there's no point in doing a tummy tuck if you're planning on having any more children, so kind of to have completed your family.
So you wouldn't just accept somebody just to come in for a procedure. You would really kind of talk them through why. And
oh, for sure. And ask them, like, examine each layer of the tummy, and you ask them what exactly is bothering them most around the tummy, because maybe you don't need to do a complete tummy tuck. Maybe you can do a smaller tummy tuck or just some liposuction. Right. The next thing is that they need to be in a healthy weight range. Right. Tummy tucks and liposuction, they're not treatments for obesity. Someone needs to be in a healthy, have a healthy body mass index. Not talking about being super low, but you need to be healthy. You need to have, you'll see people, and they think that they can just get all their fat liposuction, but it's more, these type of things are at the end of, at the tail end of any weight loss.
It's not just the solution that to have the tummy tuck. There's much more before, and the consultation, I think this is where I think that is the most important. This is the way the conversations and the questions need to be answered, like what exactly, why, and like what does it all entail? Because I think a lot of people, when you don't do enough research and preparation, ask questions, I think that's where you kind of even have a miscommunication of something as well.
Oh my God, definitely. And also, so I always have minimum for something like a tummy tuck, there's minimum 2 consultations before the operation. Sometimes there's even 3. I also ask them if they have partners at home, to bring them with them, because they need to be on board. It's not something that you just come in for an hour and you go home and everything's fine. With a tummy tuck, the aftercare, like you mentioned, it takes a number of weeks.
So what is the downtime? How long is a recovery? I know there's everybody's body recovers in a different rate, but like what would you suggest for someone to take? How much time off work, or
So it depends on what type of work you do, but if you've kind of low intensity work, maybe more office type based work, at least 1 week. I would say 2 weeks. One week. One week you're going.
I thought it was going to be a month.
No, well, until you're feeling really, until you're feeling back to normal, it will be a month. But your first week, I always say to people, your first week you will feel miserable. You will be. I ask people to go to walk a little bit stooped, because you don't want to be putting too much tension on the tummy. Also what I do is I have a post-op program, which I think is really, really important. So what is involved is if you say, for example, if you take Brazil or any of the South American countries where basically cosmetic surgery originated from, they will not operate on someone
from Brazil.
Not particularly, but that's where so that would be one of the epicenters. It's just super. There's just the volume of people who go through for plastic surgery every week is really, really high. So that so obviously they're kind of at the forefront of any new innovation always. And no plastic surgeon will operate, do one of the body contouring procedures on a patient unless they have a post-operative physiotherapist. Okay. So they come to their house, and this is a program that I've started here as well, and I think I'm probably the only one that that does it. So there's a physiotherapist that comes to the house every day for 10 days after the operation.
That's
and does
wonderful.
lymphatic drainage.
Yes, yes, yes.
It changes the person's experience completely. You know, there's the discomfort, the swelling
And so
is
many
so much more
questions that
improved.
you would have after that. And, you know, sometimes, you know, if you say to your husband or your partner that, oh, I'm feeling this way, well, you shouldn't have had it done in the first place. Why did you have it? And it just becomes like the opposite. Instead of actually having someone who's actually on your side and actually feeling that pain, you know, it can cope. You know, then you're left on your own, and what do you do?
Yeah. That's why they need to be involved, and they need to know that this is, you know, that this is something that's going to improve, that this person is going to make them happier and improve their life, and they need to be supported with when they're going through the process. So it's 1 week of feeling kind of miserable. You have your aftercare for 10 days where you're getting lymphatic drained every day for an hour. Which also helps avoid any complications like fluid collection of blood, any contour abnormalities, all that kind of stuff that you just don't want. And then the second week, you know, you can start driving about a little bit. You'll still be a little bit up and down. By week 3, you're more back to your normal self. You're still not doing any heavy exercise, but your normal activities, you're feeling fine. You know, going shopping, you know, going to work, maybe, you know, picking up kids, things like that. And but it takes up to a month for you to feel great and for the wounds to have healed. So I would say for a tummy tuck, it's probably the most invasive of all plastic surgery procedures.
I love the fact that you have this program, this kind of aftercare, because I think you could avoid any major problems after, if there is a problem afterwards, you kind of get it straight away rather than having you know, that person to realize, actually, I'm not feeling that great, and is it something that I'm meant to be suffering? Is it abnormal pain, or is it part of the tummy tuck?
You know, like, how are you supposed to know if you've never had it before? You know,
exactly.
And also you want it to be a positive experience. You know, these are things that people probably have been thinking about. You'll always find that someone will have been mulling over it in their head for a long time, and then they make the decision, and you want it to be as pain-free mentally and physically as possible, you know, and that they have a positive experience out of it and aren't, you know, feeling really miserable and down after it. You know, that's not life enhancing, and that's what plastic surgery, in my opinion, is about. It's about enhancing your quality of life, you know.
Yeah, absolutely. And if we take the vanity, you know, to the side, the benefits that, you know, because I've seen it from a 16, 17-year-old girl who has completely transformed her life. And, you know, we do it on a non-invasive level as a makeup artist and stylist, and I can see the benefits. And as much as I love the inner self-esteem and the confidence, when you look good, you automatically feel good. You know, there's a side effects of styling, of the outer, the image, and especially with, you know, the social media being, you know, such a focus that everybody's on camera and everybody's on there to look, you know, you have to look aesthetic, and everybody likes, and who doesn't want to look good? You know, Dr. Turner, who doesn't want to look good, firstly? But if you are wanting something done, I think you should do it because you really want to do it, and it will have, and it will, I think sometimes it ripples in all parts of your life, like I've seen, you know, firsthand with my boarding school friend, you know, her relationships, her work, and everything kind of completely changed. And I think about it, and I think about the sliding doors effect, that if she didn't have it done, how would it be? And I think she'd be fine, but the way that she's dynamic now, the confidence that she has, completely different. So, you know, there is pressure. I do want to talk about how social media has totally changed the perceptions of our own bodies. You know, we've had the celebrity culture where, you know, a lot of people had procedures done, and you know, it was very an exclusive thing for just celebrities. And now with social media, I read something that people are actually wanting to come in with like Snapchat filters and say, I want to look like this person. Like, I want to look like my Snapchat filter. You know, I want to have, you know, big boobs and a big butt. And, you know, how can certain body types will not suit, right? So you have to go with your body shape, your scale, your size, and everything. I mean, that's what in proportion and in balance with who you are. But you get people who are social media, do you think there's a change now since social media's come around, and how people are perceiving their bodies? Insecurities as well, actually.
Definitely. I think the filter thing, first of all, is huge. I have had patients, and they'll ask for things that are, you know, they were like, I want it to look like this, like you said, like a filter. And you have to just say, I can't actually anatomically achieve that. You know, that's not, well, what, I can't do that, you know, that's not physically possible. So, but I would say that they are,
especially young people. I think not.
Yeah.
What I wanted to address is the younger girls and even boys, you know, but a lot of the females that are seeing this image, which is not realistic.
Yeah, I think it must be so hard to be a teenager now. I mean, it just must be, it just, the pressure just must be enormous, you know. And I think you never want to operate on someone who's young or vulnerable. That's a definite no. You just don't.
Is there an age limit that you have?
Not a personal age limit. So it would be 18 definitely, but I would very rarely operate on someone under 25, I would think.
Yeah.
But I mean, you can tell when someone comes to see you and you're talking what their, you know, what their reasons for wanting this procedure, and your conscience should kick in, and you can't do things that are, you know. I always try to think, you know, if it was me, what would I want someone telling me? And you want someone who's human and, you know, is going to have a bit of empathy and like, no, look, this isn't the right procedure. That's you're not, you know, that's not the way everyone looks. There's a lot of filters. There's this, there's that, you know.
A lot of your clients that, you know, sorry, but this, I can't do this on you. This will not suit you, or this is not something for you.
I would say about, yeah, I mean, definitely, I have no problem saying that. I mean, because I don't think, it's, first of all, it's unethical doing things that you don't think are right. That's, you know, it has to be an appropriate procedure for, you know, the right patient. And I would rather not do an operation. I mean, because you can really damage someone's life, you know. That's a serious thing. It's someone's body, you know, and it's a big responsibility. And I think always, oh, I don't know, it's a real I think I always talk about this with one of my best friends is a plastic surgeon as well, and we always talk about this, and we talk about the really young girls who are coming in, but the problem is that they will go, if someone has this idea in their head, whatever I say, you know, they will go, and the unfortunate thing in my industry is that there will be always somebody who will do it. They will go out and they will find, you know, I know of, there's always someone who's gonna push the boundaries and push the limits. But it's a personal decision I just made at the start of my career. So I don't want that, you know. Would rather just operate less, if that's what it means, and just do good work, really, because that's why you're going to feel good about yourself as well.
Yeah, of course, it's long term, isn't it? It's part of your profession not to just do something short term. And, you know, you obviously, your clients, everything's based on trust. Everything's based on trust and integrity. So, you know, this time during COVID, in this last 4 or 5 months, how's your business been affected? With clients, and obviously you said that you're not able to fly now and travel to Doha, but regarding work and your practice and as an entrepreneur, how has it affected you?
So I stopped working at the end of March when there was the lockdown, but I actually had COVID myself then, so I was sick for a couple of weeks, so it didn't really bother me that much.
I actually did the same. I was recovering most of the time, so I didn't even know what everybody was doing.
Yeah. Did you have it as well?
I had all the symptoms as well, and I had just got back from Dubai, and I just thought it was a bit of jet lag, or maybe I'm just not feeling good.
You're like, oh, hey, I've had COVID.
And then I was like, okay, I can't breathe. And I rang my friend who works with the ambulance service, and he goes, I'm going to drop an inhaler off. And I literally had these excruciating pains for about 2 months, that I would wake up with pain and go to sleep with pain. I think I had a really bad kind of the side effect of it, and it was really bad. So besides that, yeah, I don't really much. I was just mostly my recovery. I didn't know what was going on in the world. But like
So that
yourself,
was the
it must
same
have
with
been
me.
scary. I mean, for me, I was really, really scared because I've got my mother who's 70 plus, asthmatic and diabetic and all sorts. So for me, I was worried, but she was, poor thing, she was looking after me most of the time.
Oh.
So, but with yourself, I mean, you know, business, and so you actually did you get tested or not?
No, I didn't no. So I've been tested since, because to operate, to be in
Back
the
in,
hospital where I work out of, we need to do antibody tests every 6 weeks.
Right, yeah.
So I've been tested, so I know now. But at the time, I wasn't tested. So
Yeah.
probably about a month. So I was sick, so I couldn't have worked. So
yeah.
And then in May, I started going back doing hand surgery and skin surgery. So so that's an aspect of my practice that is, people need their hand surgery, people need their skin surgery done, talking about cancerous lesions, things like that.
Yes.
So went back on a limited capacity in May, obviously with all the PPE, etc. And it's really only been the last month or so, the last 2 months, that we started doing more cosmetic based procedures again. Because it also didn't feel, you just didn't, if anyone goes for general anesthetic, we didn't know what impact COVID has on their lungs in that case. So it's, it's only been that we're only starting to feel comfortable getting back to normal now. So it's obviously, it's been, it's like anyone's business. It's been about pivoting and, constantly trying to, keep up to date with all the guidelines. And I think probably just try to stay positive. And
I think if there's anything in my friends conversation that I've been having, I think they've all decided to have treatments done, and I was like, I like every single one, and I was like, what's going on here?
I think I'm in a couple of patients' social bubble. I think they come to see me so regularly, and I think I'm in their little bubble.
And I was like, so we were just talking about how the lipstick effect, like, people who have gone through recession, they don't give up their lipstick and cosmetics. And I find that, like, everybody I know who's had treatments done, fillers and Botox and all sorts, that they couldn't live with that. And then the first thing that they did was to make appointments and get their faces kind of touched up and whatnot. And so they were happy. I mean, that was probably the first thing that, besides the haircut, I think that they went to see their consultants, and
people were coming in, and they were just so, when people haven't been having social interaction for a while.
Yes.
I had patients for a half an hour appointment who were in for an hour and a half, because they were just so excited to be out and be talking. And it was definitely, it's obviously like anyone getting back to normal. It's been,
is there something you'll be changing regarding the practice that you have with knowing about COVID now? Is there certain things that you put into place regarding any of your work, or is there any major change that you've done? So if somebody before pre-COVID and now, is there a change that you have in procedures?
So for any operation, it's now there's patients need to isolate for a week beforehand,
right?
So like all the pre-operative tests that you would normally have done, people get swabbed for MRSA, people get their blood test taken. Now there's the COVID test in there. It's just become, it's just been built into the kind of the standardized pre-operative care.
Yes.
And obviously there's always checks before patients come for their consultations or their treatment appointments. Make sure that you're not symptomatic, etc. Just the usual COVID guidelines apply to consultations, etc. But people who need an operation, they need to self-isolate and they need to have a test done. And it's super routine now, because we're not expecting it to be going, away anytime in the near future.
I think, next 6 months, I think we're still going to be like this anyway. So, like, what do you do personally? So when you have a difficulty or a challenge, i.e. COVID or anything else, how do you deal with it?
I think I try and see it in perspective, I think, but that doesn't always help, but because, you know, if your own personal difficulties or your challenges are your own personal challenges, and there's always going to be someone who's worse off, but you know, that's what you're feeling, so you need to honor that. I like to, if I'm having kind of, I don't know, negative thoughts, and you know, I'm feeling a bit down, what I like to try and, you know, just kind of take a step back and say, why am I telling myself, because your thoughts you're telling yourself, you know, and so why am I telling myself these thoughts? I can, you know, and try and change my thoughts to something else that makes me feel better. But I try and get fresh air, try and go for a walk or run, you know, and have a bit of fun. Like, even, you know, call a friend that makes you laugh, or just watch a funny clip, watch some Saturday Night Live. It's like my go-to if I'm feeling a little bit stressed, or especially in the last couple of months when, you know, it's been quite uncertain with COVID, and take the professional stress out of it. It's like everyone, like you said about, you know, your mom, everyone's got that worry about their, you know, their own loved ones, and even when you were ill yourself, you know, you quite worried, you don't know, you know, how is it going to turn out.
Absolutely.
But
absolutely.
yeah, so I think just trying to have, you know, I always just make some jokes and have some fun.
So humor,
and, you know, humor. That's
definitely, and I think which has been amazing. So what's your kind of personal lesson that you've learned from this last few months?
I think to live more in the now and just be content with what we're, you know, that sure, we can't do everything that we would have normally done, but you can still be content and be happy in your day. To try and just to try and enjoy the day and not think too far ahead, I think. And also I think what was challenging for me is not being able to, and probably so many people, not being able to control, you know, not being able to say, I'm going there, then I'm doing that. So, you know, your life isn't in your control with regards to, you know, the unpredictability of the disease. It could affect anyone, or just being able to plan things in your life. So I think just going with the flow and just trying to enjoy the day. I think it's made me slow down a bit, like it's done lots of people, and I think that's been definitely a positive thing, because you can get, you know, you're on this little wheel that you're busy, and you're going and you're going and you're going, and you know, you don't take time during the day just to chill out for a minute and say, this is actually really nice, you know, having a really nice lunch here, or, you know, it's really nice weather out. Just appreciate the day, the smaller things, I suppose.
Appreciate, exactly. Is there I was going to say about your style inspiration, so is there anybody that you aspire to? And that's the first question, but the second one is that is there a woman, or is there a celebrity that people come in and say, I want to look like this person? Is there someone that is most popular, and who is your style inspiration?
So with the someone coming in with there's never one particular person. What someone will do is they'll find a feature it's usually on someone on Instagram.
Right.
They find the feature. So, you know, someone who wants a certain shape of lip, you know, they'll bring that, and they'll just have tons of that one person's lip. So I think it's people focus in on a certain feature on a certain. It's always people from Instagram now.
Right.
God, it's so tough. I think someone who, I think, you know, that is very glamorous, and, you know, because it you know, it takes a little bit of effort to you know, do your hair and do your makeup and put your outfit together, and you know, I think someone who probably I think someone who, and you know, it makes you feel better and it makes other people feel better. You know, whenever you see someone who looks fantastic walking down the street, you think, oh wow, they look, you know, it's something nice that happens in your day. So I think someone like Amal Clooney, I always think she looks immaculate, you know, and just someone who just kind of, I suppose, you know, just put some effort.
Effortless as well. I think she is well put together, but I think the way she carries herself, it seems so effortless.
It doesn't seem like
she threw it on, and she just naturally just woke up like this. Yeah, she's like.
I don't know. Who are your style icons? I think I have, you know, just so many. Who comes to your
I think, like you said, there's so many aspects of a person that you like for maybe a business point of view, or you know, the style you know, expression. I just had a guest on who worked for Vivienne Westwood, so there's elements of certain designers that I like, or there's a you know, an era of like Art Deco that I like, or Marilyn at the back, you know. So you know, I think and everybody has, I think the perception of beauty is completely completely different now. How people had this conventional idea of the blonde, blue eyes,
yeah,
or even the figure, or however you see in, you know, the industry, the fashion and models are changing completely. The conventional beauty ideal that we, you know, that we've seen media and in magazines is not what we see on Instagram or TikTok now. The people are in all shapes and forms, and you know, beauty's in a different expression. It's completely unique now. It's not conforming to anything. So perception of beauty is completely different. This is why I say that actually accept and enjoy who you are, you know, unless you really are having some, if you have difficulty, but if you can afford it, if you can, if you have the time, the money, the energy, and if you really, really want it, then I would say to have procedures. And it always helps having something done. I think there's no harm in it. I think it's just the way of the world. Why shouldn't you look good? But I also feel that, you know, accepting your own unique body and your own self, you know, God's creation, I think that's also very helpful to really have appreciation of your own features, you know, like I've got curly crazy hair to my Iranian nose, my Arab eyes, my, you know, like I've got, I'm out of focus now, but like, you know, I've got very Arab eyebrow, you know what I mean? So I love what I, you know, who I am. And I think that's the whole point of being in style and you know, makeup, because you can change. So I think that
that always, you always notice that if someone is happy in themselves, they come across as an attractive person. Absolutely. They're going to appeal to you. And what you just said about, you know, there being all so many different types of beauty that we're seeing it, I think that's so refreshing. You know, it's such a good thing that and I think just what you said about, you know, I think with my patients as well, it's always, you know, when you're trying to decide whether, you know, whether to operate on that person or not, if that person thinks that one thing is going to change their life, you know, that's going to change their life completely, it's not, you know, it's, you know, someone needs to be in a generally happy place. Yes. Sure, that one thing might make them a little bit happier, but it's not going to solve every problem.
It does, but what I like about, I guess I can relate with you, is that anybody that's having like a new chapter in their life, or they're starting a new beginning, or they feel like a, you know, like a new start, a fresh start. I feel like they come to me because they want a completely new look for their hair or their makeup, or they want a completely different style, and that signifies their style also it's like a new chapter for their life. And I think that's like with the work that you do, because you're literally kind of transforming them into this new person, for a new chapter of their life, and it's a new beginning. And that's why it's so amazing. And that's why I say, don't knock it. Don't think that, you know, people don't understand and it's much more deeper than that. It's much more deeper than that.
Yeah, but it's like anything, you know, people have just certain, it's like a lot of people, they just throw out comments, you know, they don't think about kind of what they're saying sometimes, or they might have just heard the threat, so they'll do that. But no, it's I mean, you know yourself, I mean, I always, if I put on makeup, if I do my hair, you feel like
beautiful in your black and white picture, by the way, on your
Instagram.
Thank you. I was like, whoa, that's amazing. You look beautiful. I mean, still beautiful, and I love your outfit, by the way. I love leopard print, so yeah.
My leopard print,
you're completely on trend.
I put on, I have heat. So this is something I do. I wear my, like, what I do when I'm around. So Mondays are always since COVID, they're my admin day at home, work from home day, where I try and do all the stuff, part of the business that you don't like doing, like the accounting and all that. But I wear either my summer clothes. I've always done that. When it's in the winter, I wear like summer dresses at home.
Yeah.
Like and I put on heels sometimes. Most of the time I'm in tracksuits, but if I want to feel better, so I put on.
Oh, and it makes, you know what?
You feel a little bit like more, and it comes back to life being so short. It's like, why, you know, who cares if it's going to make you feel a little bit better when you're walking around the house on your Monday? Why not put some heels on for an hour, you know?
Yeah, actually, it helps with depression. So actually putting makeup on and because I have so many people have been messaging me saying, oh my God, like I said, hey, you need to get back into a routine and then get dressed up. I know you're not going to go out the door, but get dressed up, get ready. So when you're at your desk at 9 o'clock in the morning, or whatever time you're going to clock into your computer system or whatever, that you are ready and you should be ready every single day. Why would you want to let it slip? And I said, then I said to everybody in my club, I said, like, now you got to post a picture of what you're doing. Like every morning I should say, have a good morning selfie. I need to see you, because people have just let themselves go in this whole few months, and they've gone into depression. So even wearing a red lipstick or looking good, or it changes your whole
and it's like you do it, and it just shows that you're doing it for yourself, because it makes you feel, it gives you that lift,
yes.
And it's transformative, really. I think we're kind of lucky and unlucky in a way as females that we can do that, but also I suppose that it's expected kind of as well. It's a double-edged sword really. But
I do find that like the world is changing and everything around it is changing, and as you said, that growing up was so different. What is it that you would tell your younger self, like if you were to tell any advice and give yourself advice, what would you say?
Oh my God. I think it would probably be definitely something, first of all, will be about, I think I probably, like most girls, spent a lot of time, like, when you're dating boys and you think, oh, maybe he likes me and maybe he doesn't, I think if he likes you, he will text you. I think that would have been something that I would have been delighted to hear.
You'll know about it. Exactly.
Yeah. If when I was 16, 17, that would have been great to just accept and know. I probably would have saved a lot of time, like looking at my phone late at night. I think I think when you're younger, when I was younger, little things would have taken up so much more headspace. I would have worried about them, and I would have thought, oh my God, stressing unnecessarily about little things. So I think if it's not going to matter, this is a cheesy cliche line, but if it's not going to matter in 5 years, don't spend more than 5 minutes worrying about it. That's what I always say to my nieces and nephews. I say, just forget about it, just forget about it.
Yeah, absolutely. And what we all imagine something, and the thing that we worry about, actually it doesn't even exist. It doesn't even happen at the end of the day. I spend all that time consumed by the worry. So my father would say to me, don't worry. Don't worry. That's the favorite line, don't worry. So you're absolutely right.
My mum used to say 99% of what you worry about never happens. And I still think that. I'm like,
and it's so true. It's so true.
Because you can spend just so much time wasting time just having all these negative worries and thoughts, and they're just pointless.
Absolutely. So where do you see yourself in 5 years' time? Is there, what would you like to be doing, or is there is there a trend that is happening, or do you see something different in the next 5 years? What is it that will be changing, and how would you like to change your practice?
So I think professionally wise, I think something that it is a part of my practice now, but I think it's gonna, in 5 years, it's gonna be the thing is fat transfer. So it's essentially instead of using dermal fillers, things like that, you take a little bit of the body's own fat and use it in the same way.
That's so that recycling, isn't it? Like, why would you want to extract?
It just makes sense, doesn't it?
Yeah, exactly. And I guess, what are the benefits to that? Is it the fact that it's your own DNA, it's your own body, that it's not going to be alien when it's injected? How will that benefit then?
That's one. I think it has the benefit of, you can maybe take a little bit of fat from somewhere that you have a little extra bit that you don't mind losing 50 mils or 100 mils of it. That's one benefit. But the fact that it's permanent is good, because it's with fillers, etc., they do break down in the body over a period of months. They repeat treatments, but with a fat transfer, it's essentially it's a permanent solution. So that's something that's really good.
Brilliant.
I think there's a trend in skincare. I don't know what you think about this, but I think it will become more simplified again. I think we're in this period of time at the moment where
going back to simple life.
Not simple life in that we just use Vaseline on our face at night time.
I don't think we'll be doing that.
But I think simplification of the formulations of the product, so there's like less steps. So it's and it's so that people are clearer in the head. Because I have a lot of patients and clients, they're just getting really confused about it's like, which serum am I supposed to use here, and I'm supposed to use 10 different steps. And I think the formulations will get a lot more sophisticated. So it's you're literally using your one product in the morning, one product at nighttime. They are two things that I think will happen. And I think fat transfer in general because we'll replace breast augmentations, breast implants. In 5 years, oh my God, that's such a tough question.
Like to do? Where do you see yourself? I mean, I know that you're traveling internationally, but is there anything else that you would like where you or your business to be in a different place?
I think I would like probably by that stage in my career, I've always had this dream that I'd love to go to an area of the world but that don't really have access to special surgical care, and have a center or some sort of a facility there. I think that is a long-term dream of mine. Whether or not it's in 5 years, maybe it'll start smaller in 5 years, but I have a vision of myself, when I retire, or maybe even when I stop, just operating in, I don't know what, a smaller community, and just providing, because with plastic surgery, it's got all the burns, the hand surgery, all things that are really important for, people's life. And there's a real lack of access to those type of facilities and services in certain parts of the world. So that is something that is my long-term goal, to set something like that up, I would say.
I was going to say goodbye to you, but I thought I'll let me have a personal consultation with you. So I'm having this, so my sister also loves skincare. And I'm not, even though I'm in styling and makeup, when you do it all the time and that's your job and it's your occupation, you actually don't want to do it on yourself. You just want to relax.
Yeah.
And so you just want to take time out. And I was saying to my sister, like, I'm a graduate of IT and management. I have a background in education. So, and now I've started doing much more videos and, everything's regarding your computer. And I was like, I think the 4 months that I was sick, I was looking down on my phone and I said, oh, I've got these 2 lines. And she goes, oh, you've got tech neck. Have you heard of it? So you've heard of it, but like, she goes, oh my God, Miriam, you've got a tech neck going on there. And I was like, what the hell is a tech neck? And I was like, where did this come from? Where is it? Have you noticed a lot of changes even with technology, the way that our lifestyle has become, and how like posture and things regarding but regarding technic, what would you
definitely that is I think that, so for technic, what is perfect for technic is essentially one of the type of dermal fillers that we spoke about that has those remodeling properties. So
right
a series of injections, so you have quite a liquid dermal filler that spreads out and just gives you super hydration without having to try and individually fill in the line, because sometimes that can end up quite obvious. So that is always something that's kind of the first port of call for tech.
I don't know, it just appeared. So I will be coming to see you and I will document everything when my experience when I come and see you. But I was like, when you start getting those little, alhamdulillah, God, it's given me a little bit of a younger, youthful face. But I feel like my eyes, when you're really tired and, you can't cover it with makeup, but, so certain things now appear. And, if you can, and, why not? I always say, you should improve yourself,
if it's going to make you feel better.
The biggest project that you will work on. And so, you have to be happy at the end of the day.
Amen.
Thank you so much for joining.
Thank you so much.
I was going to say, is there anything that you would like to leave our audience with, a message for the ladies? Firstly, anybody who wants to get into plastic surgery, or somebody who is aspiring to be someone like you, and so someone who wants to come into this field of work, what advice for them? And secondly, advice for all of us regarding any message or anything that you would think that we would benefit from.
I think for people who maybe aspire, I think that would be something that they would really enjoy to do, is to just go for it. Be prepared that it's going to take quite a while, but don't lose sight of the goal.
How long did it take you with your training?
Postgraduate, 9 years, I think. So it's a long journey, but those years are fun as well. They're the years that you're not going to get back. When you look back at them and you kind of think of them as like your war years, your war stories. You're like, we all have these. I can remember so many occasions when you're just so sleep deprived, and some of it, there's so many funny stories as well you have with your colleagues and things. So I would say it's not all doom and gloom. It's an enriching experience. If you really want to go for it, just go for it. And for all the ladies, I think it's something that we've been touching on completely, you know, through the entire thing. If it's going to go to someone, you know, identify what's annoying you, you know, be able to say to the person, this is what I would like to improve. You know, this is what this feature or this aspect of my face or my body is starting to get me down, maybe. That's number one, because you have to be able to, you need to communicate that for the person to be able to give you the options for that specific area. Do your research, you know, and if it's going to make you happier, if it's going to, you know, go for it.
Excellent. Thank you so much. And how do people find you? Just through Instagram, or whereabouts are you based in Harley Street? Or shall I just put the details?
Yeah, so
on the podcast.
It's all the details. So you can just go to the website, which is drturnerharleystreet.com. It has all the, you know, you can get the email address, which is info@drturnerharleystreet.com, I think. And there's also the phone numbers, etc. there. So for the girls that
what are your hours of
admin,
work? Are you working Monday to Friday, or do you work on the weekends?
I do one Saturday a month.
Right.
So I do some kind of late sessions. You know, we work around some people. We have certain clinic sessions for people who work during the week, and they also suit me because I'll come out of theatre and then I can see some patients after that. But the girls are fantastic. I have a really experienced team as well. So the person who picks up the phone when you call, they have over 10 years experience dealing with people like you. So, you know, they're able to answer your questions.
Yes.
Really, you know, with a lot of knowledge. So, and sometimes you just want to, you know, ask really basic thing, you know, and it might just be because you might not be at that point where you want to come for a consultation, or you're not at that point where you're thinking you would like to have something done yet. But just if you haven't, you know, just to have a question, they're really good at just being able to answer all those type of questions. So
that's brilliant, because I think it is sometimes, like you said, some people are pondering over the thought of having something done, but initially just having to start that conversation and to get some research done, and that's brilliant. Thank you so much, Dr. Turner. I have learned so much. I've learned so much, and I feel like our audience will be much more better equipped and feel safe. And the best thing is that, you know, to have somebody trusted and an expert of what you're doing. I'm so honored, honestly, and hope there's more plastic surgeons like yourself coming up. Thank you so much for joining us.
Oh, thank you, Mariam. It's been loads of fun.
I'd love to have you. And maybe do a part 2 afterwards.
Exactly. Yeah. We do some this is the before, and we'll do the after.
Yes, and I will come in definitely to see you.
It'd be great to see you.
Thank you so much.
Okay, no problem. Bye, Mariam.
Bye-bye. So that's